This would be a disaster for my state.
It's strictly budget oriented.
I think this is going to be big trouble.
This destroys Medicaid as we know it.
This bill does nothing to reduce health care costs.
That last lawmaker you saw there is Congressman Raul Ruiz of California, just one of the Democrats on the Energy and Commerce Committee, unleashing their outrage and pulling an all-nighter, marking up the Republicans' health care bill. Right now, I want you to look at this. This is a live look at the committee. I've got to say, they look pretty good. They're approaching 23 hours in those seats talking. And lucky us, Congressman Raul Ruiz has stepped out of that meeting, and he joins me now. First, how are you holding up?
Well, we're holding up. You know, I'm an emergency medicine doctor. I'm trained to think, be sharp on my feet for long hours. So I'm fine. I'm ready to go another 24 hours if needed to protect health care for the American people.
Then actually, let's start with that.
A little disheveled, I would like to shave. Yeah.
Well, then more than as a Democrat, as an ER doctor, what do you think is the biggest problem in this bill? What would hurt the American people the most as a doctor?
You know, as a doctor, I want my patients to have health insurance. I want them to be able to come into the emergency department and feel secure that they will get the care that they need and not have to worry about the cost of the bill or the cost of medicine. And this bill will be disastrous for working families. This is a violation of the American value of fairness. This will create millions more of uninsured patients. It will increase the cost for working families who are already struggling to live paycheck to paycheck, while giving tax breaks to corporations and making health more affordable for millionaires. That's an outrage, and this is contrary to the American value of fairness.
If this is so bad, then why not just let it go through? Let the Republicans get it through, and let's see what it does. Because if what you do is block it, can't the Republicans say, listen, we tried to make things better, we tried, but the Democrats wouldn't play ball?
Yeah, see, you know, that's what the Republicans did with the Affordable Care Act. They sabotaged it in order to try to play the blame game later for political gain. And I'm not, I don't take part of that because I'm a physician. The American people are sick of that. I want to fight till the very end to do what's right for the American people, because I took a Hippocratic oath to first do no harm. So I will be here another 24 hours if necessary to fight these proposals that will essentially strip health insurance for millions of people. The Medicaid program is in jeopardy right now. They want to do a per capita block grant, which means that over time, due to any unexpected epidemic or new expensive drugs, the block grant payment to states will be underfunded for the actual cost of states' health care, which means that they will cut eligibility, more people uninsured. They will cut the benefits, meaning that less coverage for patients on Medicaid, and they will reimburse hospitals and physicians less, meaning that less providers will choose to see patients on Medicaid. And that is unacceptable for working families and for the millions that have had the Medicaid expansion. There's millions of people who now benefit with the Medicaid expansions that they will repeal and halt after the year 2020, according to this bill.
All right, well, you've got over 100 amendments proposed. Doesn't seem like anything has gone through yet. Is there any hope? Is there any middle ground here?
Yeah, you know what, so far all the amendments have been voted by party line. But let me give you a couple of behind-the-scenes agreements that I have found with the Republican colleagues. The first is the fact that at the very least, disaster care should not be put into a per capita block grant, that we should be able to fund all of the disaster humanitarian crisis care care that we can for the American people. There is a Republican who came over after my points and said, I never saw it that way. Thank you for giving us your doctor perspective. I'm going to go back and think about it a little more. The second part was the fact that I agree with my Republican colleague who said that mental health is in a crisis and there are more mental health patients being seen in the emergency department, and we need to do something about it. Now, the reason why we have this crisis is because throughout the years, the Republicans have cut mental health programs, aid. They have recently had a bill that didn't fund it to its proper degree, mental health services that is. There is a physician and mental health specialist shortage crisis in our nation, and now we have millions more who have the essential benefit of mental health. And that essential benefit is going to be cut with this bill, and mental health states will now have the option, not the guarantee. Patients will not have the guarantee because states will now have the option of choosing to provide mental health or not, and that's not right.
All right, Congressman, thank you so much for your help this morning. You probably want to have a cup of coffee before you head back in there. It's a lot of work.
I will.